Run on that white neck eagle. White neck eagle population was reducing in one US area, and they thought like people are catching them and eating, and did a survey that people never eat that eagle. Then they started search for dead bodies. There were no dead bodies at all. Then what is happening? Then they enhanced their searches and they came to know that breaking of immature eggs. Breaking of immature eggs. What has happened is these birds were fed on a lake in that area, means fishes of that particular water reservoir. To that, industrial water was dumped. So heavy metal deposition was there in those fish, and that was transferred to these eagle bodies, and that led to reproductive toxicity, making the egg shell more and more delicate so that it cannot sustain entire hatching period. Before the egg is hatched, egg used to break. So that is why the population was reduced. So it is coming in human body also. So meat comes with hormones, it comes with pesticides, fertilizers, because उनको खिलाने के लिए जो भी कल्टिवेट करेंगे ना वो, और स्टेरॉइड्स भी डालते हैं उसमें वेट बढ़ाने के लिए. One of the most important cause for PCOD in non-vegetarian females is the meat. Second is E disease. E disease. Okay. To add to this, adulterants are there, additives are there, preservatives are there, irrational medication, occupation, pollution, and all those things accumulate all this. Next, please. But why we need to understand this? For example, next, please. One more. Okay, this is Viruddha, naturally. One more. Naturally, matsya and milk, or non-vegetarian food and milk is said to be best nidana for kushta, kushtakara. Okay, naturally it is. Now, present day, meat or the fish comes with heavy metals, milk comes with adulterants. Still, it causes kushta. Is it right to consider it as normal viruddha? Is it right to call it as normal viruddha? Or is it something else? It is. It is Savisha viruddha now. It's not only viruddha, it is Savisha viruddha. Next, please. So, why they are not affecting immediately? So why they are not affecting immediately? Because they all are low potent poisons, which we call as Dushi Visha, Kalantara Prakopi Visham. Okay, next please. Okay, what they do? They accumulate in the body as low potent poisons, and then they affect our immunity, because most important target of Visha is Oja. Okay, that is immunity. They affect immunity. Dushi Visha then, next please, it creates autoimmunity. So if it affects Rakta, then it causes skin diseases. By affecting Oja, it causes immune-related disease like autoimmunity. Next, please. Next, please. So, only understanding Hetu is not important. Even if we are able to elicit Hetu and we can advise diet or Vishagna Aushadhi, that is not enough. We need to understand Samprapti also. Understanding Samprapti means what? It's not like understanding the lines of shloka, whatever it is, with word by word meaning. It's not like that. The meaning of Samprapti, Chikitsa is Samprapti Vigatanam Eva Chikitsa, means after reading the Samprapti, we should get some factors or targets on which the treatment should be targeted. Right? Next, please. Next, please. This is the Samprapti. Okay, this is the Samprapti you all know. Next, please. Can we expect same thing with all these presentations? Here you can see it is ichthyosis, fish-like scaly skin is there. Here folliculitis is there. Their presentation is different, and there it is vitiligo or white patch is there. Samprapti is same. Next, please. These are different diseases. Now we'll take only one disease. For example, psoriasis. All the 8 patients are of psoriasis. All the 8 patients are psoriasis. Can we say all have same Samprapti or all have same Samprapti Gatakas? Next, please. Why we need to understand that? Because, next please, it is said Samprapti Vigatanam Eva Chikitsa. To give right Chikitsa, what is that? Apunarbhava Chikitsa, which is very important in dermatology. We need to be thorough in understanding Samprapti of each and every disease condition in a disease. Not just disease. Not just disease. Because in Ayurveda, we don't have any medicine for a particular disease. Particularly in Kushta, if you see, we get hardly few, Siddhmahara Lepa, Kandugna Lepa, like that. There is not a single drug explained like Sigma, this is for Sigma, this is for, Ekakushta, this is for, no. Nowhere in Ayurveda we get such medicine. Same may be true with all the diseases, other diseases also. So, individual disease, inside the disease we need to understand what is the thing. Next please. Now, psoriasis, as I was telling, how to understanding Samprapti means what? For example, what is psoriasis? Psoriasis, in its autoimmune disease, there will be increased epidermal turnover. What it means? 24 or 28 days skin cell cycle is reduced to 3 to 4 days. Means premature aging of the skin cells. Okay. In Ayurveda, what we call, in modern, what is the reason? It is because of overreactive immune system. Okay. Once it is stimulated, it starts. Okay. So, in Ayurveda, any conversion we call as Paka. In Ayurveda, we call any conversion. For example, graying of the hair, we call it as Palitya. Right? It is premature graying. So, that is why we call it as Palitya. So, anything that is converting is nothing but Paka. So, here, the cell lifespan of 28 days has reduced to 4 to 5 days, means it is getting more and more Paka. So, we are getting points, right? We are getting triggers. We need to understand that in psoriasis, Pitta is causing early Paka. And we compare it with Sigma. Some compare it with Kitiba, some with Eka Kushta, whatever it may be. All the three are Vata Kaphaja Kushta only. Right? Sigma is Vata Kaphaja, Kitiba is Vata Kaphaja, Eka Kushta is Vata Kaphaja. But I am telling here, the main culprit is Pitta. Right? Next please. Now, Paka we need to understand. That is very important. Next please. There are two types of Pakas we can make out by Pitta. It's a type of, or what is the condition of Pitta, depending on that Paka will be taking. For example, when Pitta is there, normal Pitta, more Kapha, less Vata. So it will be Drava Pitta. That leads to a Paka. That Paka will be having oozing, pus formation, etc. Like eczema. Okay. Same, when less Kapha is there, more Vata is there. So it will be Sasneha Pitta. And there will be scaling and oily skin will be there. Next slide, please. Now you can see, both are Paka only. In both, there is death of the cell. Dono mein, cells are dying in both the conditions. But the nature of death is different because that is determined by the Pitta. The condition of the Pitta and association of Vata and Kapha with Pitta. Now here, it is more Drava Pitta, so we are getting eczematized type of presentations, whereas there it is not so Drava, not so Ruksha, it is Sasneha Pitta. We are getting that. Imagine if it is more Vata, very less Pitta, then there will be severe burning, dry red patches will be there. If more Kapha, more Vata, less Pitta, then it will be stony hard, like lichen planus and all. Everything is death of the cell only. It is the conversion influenced by Pitta. How Vata and Kapha are associating with that, depending on that, the presentation varies. Next, please. So, by this, what we understand? Now, understanding Ayurveda pathology, Ayurveda Samprapti, and modern pathology of psoriasis. This is the way I told, like, how we need to study Samprapti. So, psoriasis, what we understood by this? Psoriasis is autoimmune disease. Dushivisha, by affecting Oja, brings autoimmunity because we saw the etiology. Etiology is Dushivisha. There is autoimmunity. So, Dushivisha affects Oja, so brings in autoimmunity. Psoriasis follows Koebner phenomena. Koebner phenomena, irritation leads to aggravation. And it is a psychosomatic disease also. So, what are there? First one is Paka. Second one is autoimmune disease due to Oja, Dushivisha, Koebner phenomena. So, we should not irritate the skin. And it is a psychosomatic disease. Right? Next, please. So, by that, we got these 4 targets for the treatments. Tomorrow, I will show you how we need to treat these. So, while treating psoriasis, only 4 things we have to keep in mind. Treat Pitta, use Vishagna Ushadis, educate the patient, and do Sattva Uja. For dermatology, increasing Sattva, not that difficult. Documentation is enough. Document. Next time when patient comes, is not confident, previous patients before and after photograph you show, patient will be okay. He says, okay, I will take your treatment. Other than dermatology, it is a little bit difficult. Okay, next please. The most important, most of the the Google form had this one. Difficulty in diagnosis. No problem. No problem at all. Vagbhatacharya says, Vikaranam hi akushalo na jihnyat kadachana. If you are a person who is weak in diagnosing disease by name, never feel shy. Na jihnyat kadachana. Never feel shy, never feel inferior. Because na hi sarva vikaranam namato asti dhruvam sthiti. Because we cannot label every disease by name. We cannot label every disease by name. And in the commentary, Arundatta says it means we never treat a disease by name. And there is no medicine by name. For example, in modern we have paracetamol for fever, this is for that. No. We cannot claim Amrutottar Kashaya for fever. No. We cannot say like that. Amrutottar Kashaya for Jara. No. Hundreds of Jara are there. To which Jara you are going to give Amrutottar Kashaya? I will show you tomorrow. Even patient without Jara, we are using Amrutottar Kashaya and we are getting results. Means our medicines are like that. So everything is dependent on what we are assessing. So next please. Why it is important? What may be the diagnosis? This is a scalp, maybe this area. What may be the diagnosis? 21 aged girl. Now you may be thinking it may be Shvitra, something like that, right? This is Vaidyakrita Aparada. This was patient of alopecia areata. Actually, my wrong photography. I should have taken the photos from the side. Actually, there is saucer-like skin. The entire bulk of the scalp skin has gone. It's like completely fibrous and depigmented because the pigmentation cells are also gone. She was having alopecia areata. She went to a doctor, Ayurveda doctor. No, why I am telling? Name of the drug, condition, not work. Everybody knows, everybody have an idea that Jayapala application for. How many of you know that Jayapala is very commonly applied externally for alopecia? Anybody of you know? Very few. Okay. So, same thing was done here. So, doctor gave the girl Jayapala, rub and apply. Okay. But little advice was there. If boils are there, don't apply. Wait till the boils heal and again apply. And the patient applied it for 3 months. Severe, infection and all took place. Patient went back to the doctor. Doctor said, इतना नहीं लगाना है था. तो phone करके पूछे फिर भी लगाओ बोले. बाल नहीं आए लगाओ. So doctor gave antibiotics and all. It was reduced. After again 15 days, again same was started. And now more and more, pus and all started. And she went to modern doctor. It got healed with the steroids and all. And ultimately it became like this. Now, doctor cannot treat it. So the patient was referred to hair implantation. And they said there is no bulk of the tissue. We cannot implant. Then patient was referred to me. I too was hands up. I have not treated it. But it has helped me as one of the immense source of, communication source for my presentations. Why it happened? Jayapala is not wrong. It's not wrong using Jayapala. But in which condition, how much, how long? That is very important, right? That was forgotten here. The condition was requiring Jayapala. Okay, today we started applying Jayapala. Tomorrow or day after tomorrow, the condition has changed. We need to change it. We need to change it to next, low potency drug. Maybe the Jayapala would have stopped and some oils were given. हो सकता है. Okay, like for example, tinea capitis and all, thick skin will be there. So we need Tikshna Lepa. 1 or 2 days in the beginning you give. Then observe, there is a change. Now it is not that hard and not thick. So we need to go with less Tikshna drugs. So that is why assessment is very important. Next please. It is, what is there? Nacha kinchidasti kushta mekadosha prakopanimitam. There he says saptavida kushta, ekadasha kushta, ashtadasha kushta, whatever. And aparisankya. He says aparisankya. Kushta will become aparisankya. So that is why it's very important to assess the dosha. Next please. So we'll see now by individual lakshana as well. Ruksha means how it will be clinically. Okay, ayama means how it will be. Those things we'll see. Again, one more example I'm giving. This is allergic footwear dermatitis or whatever you call. We call it as, we diagnose it as Padukavisha. Okay, Padukavisha. All the five are Padukavisha only. But in all the five, we cannot give same medicine. Though diagnosis is same. Though diagnosis is same, we cannot give same treatment for all because the presentation is different. Why the presentation is different? Because yata dosha. As per the dosha, presentation varies. So as per the presentation, Acharya told us to give the treatment. So that is why we need to understand what are those lakshanas by which vata presents clinically, pitta presents clinically, or kapha presents clinically. Next, please. Same, psoriasis. Next, please. Varying presentations on the back, but treatment will be different. Next, please. Next. This is one of my common way of teaching. Like for example, when vata, pitta, kapha are normal, when they are normal, so you can take like this, normal chapati, how it will be, like that the skin. Okay, next please. Now if more vata is there, if the chapati is more heated with less oil, then what will happen? We get those crispy kadak chapati, roti and all. So that is vataja lakshana. Why I am giving this example? Because acharyas also have given all the day-to-day life examples only. So whenever, if you want to remember, keep in mind like what are the vataja lakshanas in skin patients. Remember such kadak roti or something like that. A tree with completely dry, scaly bark. Next, please. Kafaja, bahala, soft, spongy, kafaja lakshanas. Okay. Pittaja, I have put intentionally one item so that whenever you eat that one, you should remember that. Next, please. Exactly like this. Yellow, red, secretions, oozing and all, pittaja lakshanas. Like this high cheesy, more cheesy, what it is, pizza. Okay, next please. Now we'll see the lakshanas. This is one shloka, Samanya lakshanas. Okay, what are there? Roksha, Shosha, Toda, Shula, Sankocha, Ayama, Parusha, Kharabhava, Harsha, Shavarnatvam, Kushteshu, Atulingam. Only these are there, but we need something else. We need some more lakshanas. Next, please. So we can borrow the lakshanas from Mahakushtas, Kapala Kushta. Next, please. In Kapala Kushta, commonly in diagnosing dosha, these are four things that will help. Vishama Visritani, Kharaparyantani, Tanuni, Udrutta Bayitanuni. These four. Next, please. So we will see them one by one. What is Vishama Visruti? Irregularly spreading. Kharaparyanta, rough margins. Actually, they will be seen in clinical practice. Tanu, skin lesions will be very thin, like macular presentations, not the papular presentations. The Udrutta Tanuni means scaly skin. Okay, next please. Now we'll see one by one. Is it Vata Prakopa? Is it Vata Prakopa? You can see. I shown that chapati kadak roti. Is it Vata Prakopa? Vata Prakopa? No Vata Prakopa? Others? Nothing? It is nothing? Okay. Whatever may be the response. If you think it is Vata Prakopa, it is wrong. Why? Because the patient is having woozy lesions. You can see their pus is there. There is pus, oozing is there. What has happened is the patient has kept that leg open in the air, and because of extra environmental air, that oozed out, secretions have got dried and it has become crusting. So this is very important. Just presentation is not what looking outside. We need to feel the lesions completely. We need to touch also. So it is not actually Vata dominant. It is Kapha Pitta or Pitta Kapha dominant. Next, please. Ayama and Sankocha. Lakshana in Vataja Lakshana, Ayama and Sankocha. You can see Sankocha and Ayama in this. You can see Ayama. Ayama means stretching of the skin. Skin will be more like in case of scleroderma and all, you can see. But it's a rare condition. But morphia is one of the commonest. This is a morphia where you can see there is Ayama. And Shlakshana is one of the Lakshana of, again, Vata. Shlakshana means glass-like. Glass-like. Okay, next please. Ruksha in various type of presentations. Most often, why I have put these lesions because Some of the people have written those whitish appearance as, white patches. Our PGs and all I have seen white patch. That is not the white color. That is the dryness. Like in this you can see the middle one and that next both legs white what we are seeing, that's not the Shweta Varna, that is the Rukshata. Because of on scratching it has become whitish. So it is Ruksha. It is not Shweta. Next please. Hrishita Roma, horripilation, commonly seen. It's commonly seen. Next please. Hasti Charmavat. Hasti Charmavat, you can see there. Amyloidosis or lichen type of presentations. You can see Hasti Charmavat means follicular presentations will be there, hard follicles. When you touch that one, you will feel like that. You are as if you are touching the particularly tail of elephant. Elephant tail touching, what feeling will be there? That type of it will be there. Next please. Khara Parusha. Again Khara Parusha, touch only, for touch. Here you can see, when you touch them, you will feel that Khara and Parusha. That is ichthyosis. There you can see most of the lakshanas. It is Khara, Parusha, and there is Sankocha and Ayama. Whenever there will be multiple lesions of Sankocha, there will be Ayama. Sankocha means constriction. Some patches of skin getting constricted means other side of that gets stretched. That is Ayama. Right? Sankocha and Ayama both are seen in that. Next please. Khatina. Hard lesions. But actually Katina are Vata Pradhana Kapha. Vata Pradhana, because Katinata has to come means there should be Priti Mahabhuta. I was telling in Paka, if Pitta is less, more Vata and more Kapha, it becomes Katina, stony hard. So that Katina, when you look, we are diagnosing that as Vipadika only. But the presentation is different. There you can see how hard the lesions are. Even if you touch, you will feel like as if you are touching stone. Next please. Matsya Shakalopamam. This is the one reason why maybe psoriasis is compared with Ekakushta. We do not consider, because Matsya Shakala, I think here fish commonly eaten. If you know the fish scales, they are forcefully removed, I think. They cannot fall on their own. They are firmly adherent to the skin. You have to scrape them and remove, which is seen with ichthyosis. There will be scaly skin, but no scaling. There is lots of difference between scaling and scaly. Scaly means fish-like scale will be there. They do not fall on itself. They should be removed forcefully. In case of psoriasis, what patients say? Bed पे पड़े रहते हैं. घर में जाते कपड़े निकालते ही जमीन पे गिरता है. कभी-कभी they bring like a gift. बेड पे जो पड़ा रहता है, सर कल इतना पड़ा था लेको. Means scales. Psoriasis scales को पॉकेट में लेके आते हैं ऐसे. हाँ, और हमें देखना भी पड़ता है. देखना चाहिए. If you do not see, do not check, you will be treated or labeled as rude, non-responsive like that. Okay, it's needed in dermatology because it is always patient, not the disease. We need to treat the patient, then disease starts getting treated automatically. Next, please. Shosha. Shosha is again loss of tissue. Loss of tissue. So Vataja Shosha means it's not like peeling of the tissue. Here, shrinking of the. In that first photo I have shown you, alopecia, that is Shosha. Here you can see this is. Now, very importantly, we are treating this case for 3 years. Now she is able to move the toes and the ankle. Narsimha Rasayana and Deepana Pachana we are doing, and Yaladitela Abhyanga. Okay, only that is given. She is a young child. So there you can see morphea type of presentation. That is lichen planopilaris. Again there also there will be Shosha. Tissue loss will be there. Next please. Sankocha. That also is Sankocha. Okay, not only stretching. When it is on the muscular area, it is constriction. When it comes to joints, it is the constriction of the joints. Here you can see the palmar psoriasis has reduced the movement of the fingers. Next, please. Previous, please. Previous. Here you can see more other Vataja lakshanas also. Tanu. The scales are very thin. Right? Ruksha, Tanu, and Sankocha is there. Next, please. This is also, these three also Sankocha only. Here, Sankocha, this is alopecia, ichthyosis. There is Sankocha, morphia. That is also Sankocha. It is hidradenitis suppurativa. After treatment, it is. After treatment. Suppurative lesions will be there. Kaksha in Ayurveda. Next, please. Shava Aruna. Shava Aruna, it's like Vata Jalakshana actually. Aruna is orange type or purplish type of presentation. You can see this is the Shava Aruna presentation. Lichen planus. This is lichen planus. This is actually phytophotodermatitis. Next, please. Tanu Udrutta Bahi Tanu. Tanu, thin. Udrutta, broken or split. Bahi is Tanu, external layer of the skin. In all these. All the three are having scaly lesions. Okay, this is first one is psoriasis, that is psoriasis. Middle one is ichthyosis. Next, please. Toxputana, area to area, or site to site it changes. Toxputana in scalp, Darunaka is also it is said toxputana only. That is also toxputana. Whereas in Vipadika also toxputana is there. Sputana means what? Spota, blast. Whenever there is blast, there will be layers. Cracker, हाँ. Cracker जब blast होता है ना, उसमें जो भी layers रहते हैं, वो layers अलग अलग हो जाते हैं ऐसे, split like a flower. So here you can see the skin, how it is coming out. It is coming like layers, like a flower. That is blast, toxputana. Next, please. Again, site, depending on the site. So on the knees, joints and all, toxputana leads to cracks further because of the movements. On the heel, different type of presentation, or the sole. Okay, next, please. Udrutta Bahistok, again same. Okay, next, please. Vishama Vishruti, this is very important. Vishama Vishruti means, many times I ask our students to understand Vataja Dosha Lakshana in Kushta, to understand just Prakriti of the person. Like, you study Vata Prakriti person, you will understand Vataja Lakshanas most, how Vataja Lakshanas behave in skin. Pitta Prakriti person, how the Pitta Prakriti person behaves, same Pitta Lakshana will be behaving, like Pittaja condition will be there. Now, Vata Prakriti, what it is, Vata Prakriti people are not organized at all. You go to any, like hostel में रहते तो, या किसी के room Vata Prakriti के जो person है उसके room में जाओ, everything is messed. कुछ भी organized नहीं रहता. So, Vishama Vishruti, no rules and all. No rules at all. No pattern at all. Like it is said, psoriasis should be on extensor surfaces, it is said. But when it comes to Vata dominant psoriasis, you can see no space in the body is left. From the beginning only, from the onset only. That is Vishama Vishruti. Spreads abnormally or irregularly, no pattern at all. Next, please. Ruksha, Khara, Khatina, Shava, all coming together. Next, please. Khatina, Ghana. So you can see Khatina and Ghana, when Kapha associates with Vata, it becomes Khatina and Ghana. Next, please. Vata Jalakshanas you understood? Now you will see Pitta Jalakshanas for maybe another 7 minutes for that and 5 minutes for Kaphaja. Daha Rago, Parisrava Pakaha, Visro Gandha, Kledastata, Angapatanam, Pittakrit. Okay. Now, next please. For this, next please, we have to take Baro Lakshanas, few Lakshanas which are very important in clinical practice from Udambara Kushta. Tambrani, Bahalani, Kandu, Ashugati. Okay, these Lakshanas we will take from that. Next, please. Next. 1 minute. Now, Bahala is here. In Kafaja also, Bahala is there. So, it should be considered like contextual. Here, Bahala came because it is said after Vataja. Vataja mein kya hai? Tanu hai. So, compared to Vata, Pittaja lesions are Bahala, slightly elevated. Okay, compared to Pitta, Kaphaja lesions are more elevated. They are also Bahala. Next, please. You can see Visarpavan spreading, very quickly spreading. Raga is there, Daha is there, Visarpavan. This is herpes, that is leukocytoclastic vasculitis. It's a vasculitis. Okay, one day that much spread. So, Gati, that spread with the Raga, redness, it is Pitta. Visarpavan. Next, please. Angapatana Puya. This is one of the Lakshanas. See, maybe one of the reason why Angapatana in Kushta is explained, because of that, most of the people consider Mahakushtas except Sidma as leprosies. I never compare any of the Kushta with any leprosies because leprosy is like dead end, no possibilities. So I always try to use like उसको डेड एंड लगते रहे तो वो नॉलेज ही वेस्ट हो जाएगा ना. सो इंस्टेड ऑफ दैट कीप इट ओपन. सो उसमें डायरेक्टली कपाल कुष्ठ उदुम्बर कुष्ठ लेने से अच्छा है कि उसमें से जो भी है पॉसिबल दिखते हैं उनको ले लेंगे. ओके. लेप्रोसी आल्सो आई विल शो यू टुमारो हाउ वी कैन ट्रीट देम. So Angapatana is not always amputation, not always auto amputation. Angapatana also refers to falling of the deeper tissues or tissue loss by Parker. Okay, you can see there the deeper tissues are getting involved, and there is no loss of that. That is also Angapatana. Next, please.